Can you just explain your role in food safety and agricultural research and how you came to be involved in writing the UNEP environmental report?
Yes, well, I'm a veterinary epidemiologist. I've worked in several countries, but for the past 30 years, I've been working in developing countries. And more my work has focused on food, and especially on food which is sold in informal markets. These are markets which are different from the supermarkets, the hypermarkets, the convenience stores, the kind of the people who send you order online and they send to your door. These are the markets which supply 80 to 90% of people in Africa and a little bit less in Asia. So some of them are kind of open air markets, some are covered markets, some are people who sell along the side of the road, some are people who sell from car boot sales, some sell from small eateries, or women, often it's women who go to bus stations and they carry around food and offer it for sale. And these are what we call informal markets. I've been interested for two reasons. One is they're so huge, they really are the main supplier of food in Africa. And secondly, they are a very important market for poor farmers. That is where most of their food ends up. It doesn't end up in the hypermarkets and supermarkets. But of course, being an epidemiologist, which means I'm somebody who studies diseases, I'm also very interested in these foods as a source of disease, both what we might call the diseases which are common. They're all over the place. Diseases like Salmonella, E. coli, Listeria is a common disease, and there was the world's largest outbreak of listeriosis happened in Africa, South Africa, not very long ago. So these diseases are coming up all the time, and the burden of these diseases is comparable to that of malaria, HIV/AIDS, or TB. And I think that comes as a surprise to everybody. We all know malaria is a huge problem and there's huge investments in it. And yet the burden of foodborne disease is comparable, but the investments are tiny. But the second reason, and I think this is what kind of led into the UNEP report, is that a lot of these food systems, informal food systems, and they often involve wild meat and animal source food from unconventional sources, food which might be maybe even condemned in one place, gets diverted and sold in another place. So these foods are also an opportunity of bringing new diseases, bringing people into contact with new diseases. And wherever you go in Asia or Africa, you will see by the side of the road or in markets, you will see wild meat along with domestic meat, along live animals, along with dead animals, all mixed up. And we would call this a kind of a witch's brew of generating new diseases, which can have horrible consequences, as we've seen with COVID.
And that report was authored pretty early on in the pandemic, and it's now over a year ago, almost 2 years ago. So what has changed from your perspective since that was published, as we've gone through more of the pandemic?
I would say, just moving back a little bit, the report was authored quite early, but epidemiologists have been saying for decades there is going to be a big human pandemic which is going to kill millions of people and cost trillions of dollars. This is going to happen. We have to prepare for it. We have to make sure, invest in minimizing the consequences. And it's like Cassandra, everybody was saying this is going to happen and no one believed us. So it did come early, but it was one of a long series of, experts saying that this is going to happen. It's not a question of if, it's a question of when. So yes, that I think what has happened is, as I said, we had a lot of people saying this is going to happen, and there people, also to be fair, there are so many things to worry about. There's, runaway global warming, there's conflict, there's asteroid strikes, there's, breakdown of global stability, there's, geopolitics between huge powers in the world. So sometimes people find it very hard to know where to put their interest, their investments. And obviously we got it wrong. And I think that's one realization now, that if we had been thinking harder about pandemics and doing more to protect the world and doing more even to come up with sound scientific advice, which didn't change every week, like 1 month, no one should wear masks. 1 month, next month, everyone should. 1 month, you should wear masks when you're outside, jogging in the forest. Another, there was just a lack of clarity. People and the scientists, the experts themselves didn't know what to do. At the beginning, we thought that it was a contact. The contact was very important. So there was this big emphasis on hand washing, sanitizing, and bad ideas never die. They just continue in ghost form. So now, although we know this is mainly a respiratory infection, still, an enormous amount of effort and advice and awareness raising is about sanitization, wiping surfaces, all the rest of it, things which probably, if you have scarce resources, you would not spend them on that. You would spend them on trying to break the respiratory transmission cycle. So we've learned a lot, but we have more to learn.
So as one of those Cassandras, what's your response? Are you frustrated that people weren't listening? How do you feel about all of this?
I think there's to be self-critical too. I think experts were overconfident at the beginning, that there was a tendency to and people want certainty. There was a lot of panic. There was a lot of, uncertainty. There was a lot of fear, and there was a sort of a pressure and demand on experts to come out with, do this, don't do this. And yes, I think part of that is educating the public that when new things, and this was a novel disease, we've never had this. We've had other coronaviruses and lots of them, and some killed a lot more people. MERS, the fatality, that was the Middle East respiratory coronavirus, which killed up to 30% of people. I mean, the present COVID is killing far less than 1% of people. Yeah, we didn't have experience, and we probably should have been more open to the public that, this is something new. We're giving you our best guess, but don't take this as we know everything, because we don't know everything. We still don't know everything. I mean, I think the other thing as being the Cassandra who keeps, saying these things are on the horizon, this isn't the first and it won't be the last. There are going to be other challenges on the way, and hopefully we've learned. I'm a bit worried that we are fighting the last war. I mean, that's always the challenge. So at the moment there's loads of investment and money in COVID, but a lot of it is really not being spent wisely or well. There's a lot of efforts, but they're not coordinated or aligned. There's a lot of there's a risk that at the moment it's new, it's a worry. Everybody's just going to throw money about it and run around like headless chickens, doing everything. We need to do something. This is something. Let's do it, without anybody really coordinating it and thinking it through, and thinking not about the last pandemic, but the next pandemic, which won't be like the last pandemic. The last pandemic was bird flu, and this is nothing like bird flu. So don't expect the next one to be like COVID.
So, as you say, this is not going to be the last pandemic. Are we really seeing an increase in the frequency of spillover events and the emergence of zoonotic diseases? Yes. And why are we so worried about these diseases?
Yeah, I mean, we've done, and Kate Jones at the time was UCL, and we worked with her too. We did some going back as far as the 30s, which is when we have good good information, and that we found that undoubtedly there is an increase in these spillover events. There are many drivers. Most of them are what we call anthropogenic, which means they're based on humans, and they have to do with things like globalization, the fact that we are more and more exploiting scarce natural pristine environments. This is where a lot of diseases spill over from wildlife. Domestic animals are often involved, but the primary source in 75% of cases is wildlife, and more we are putting pressure on wildlife and their habitats, including eating them, selling them, moving them around, keeping them as pets, doing all sorts of things which really do increase risk. Also, just there's general, changes in dietary habits. In the past, maybe people that, you'd had large numbers of wildlife, small numbers of people, they would have been harvested sustainably. It wouldn't have been a problem. Now you have huge cities with huge demands for both cheap wild meat and also expensive exotic wild meat, people who will pay huge amounts of money for armadillos or other kind of pangolins, other kind of, we never had these huge cities, we never had these huge markets. So we're getting a completely different picture of the way humans interact with wild animals. And yes, and that is causing problems.
Anthropogenic factors like agriculture, intensive agriculture and factory farming, why are they so important in this picture?
Yes, they're important, not so much as a source. Some people consider antimicrobial resistance to be AMR pathogens, to be emerging diseases. I don't, for various reasons, but some people do. And definitely factory farms use more antimicrobials, and that creates antimicrobial resistance. But the other reason in terms of EIDs is that especially in low and middle income countries, intensive farms, husbandry practices are often quite poor, which means these are not really, highly sanitary, what we call biosecure, very clean environments. So there's always possibility for wild birds to fly in, to wild rats or rodents to kind of come in and eat the food. There's always food in a factory farm, and these animals have not been bred to be resistant to disease. They're in very high numbers. Factory farms can contain hundreds of thousands of animals in really close contact. So, and also many of them are clones. They've been bred to grow, like a broiler chicken has been bred to grow from an egg to something big enough to fit on a plate in 8 weeks. They haven't been bred to be disease resistant. And because they're clones, diseases spread very quickly through clones because you don't have that natural variation. If you've got a kind of a genetically mixed, heterogeneous population, maybe you'll get the new virus and get sick and die, but Albert will have slightly different DNA, and he'll be fine, he'll survive. And so the disease will tend to die out. But if everybody is a clone, if everybody has got the same DNA, then that disease is just going to spread to everyone. And those are some of the reasons why factory farms are another risk factor.
So what are some of the key things that we should be doing? I mean, you've said we need to focus on preventing future pandemics. What are some of the things that we can actually do to be proactive and not to just react like we have been trapped into doing this time around?
Yeah, there's a couple of approaches. One is what they call the virus hunting, which is just going out and seeing what's there. That is, to be honest, it's an expensive endeavor, and there's so much out there that you can do an awful lot of looking before you find something. Another approach is this kind of interesting work on kind of gain of function and looking at nasties and seeing, can you make them even nastier? And that's highly controversial, as you know. And again, it's not something which I would necessarily put most of my money in. I think what we need is surveillance. We have very poor surveillance, especially around food and informal markets. And it wouldn't be that expensive. You know, we've got mobile phones now, we've got drones, we've got, you know, big data, just to sort of get a better idea of what is going on. I've done some research, and other folk have done research which shows that if you pick up these new diseases just as they're spilling over, just as they're starting to become problematic, but before they've got, you know, widespread, you can save 90% of the costs, more than 90% of the costs. So better surveillance and quick response is what we need and what we don't have. In fact, I think we probably have, and I'm talking as a scientist, too much research and not enough implementation, and maybe that's where we need to focus more.
And what do lower income countries do when, you know, surveillance costs money?
Yeah, well, for one thing, this is a global problem, and most of the global costs, I don't have the figures at hand for COVID. People are still working on it. I know people are talking up to $10 trillion, but the World Bank did some work on if avian influenza had become a global human pandemic, which fortunately it didn't, but it easily could have, and it easily could still, like Spanish flu, which killed up to 100 million people. Nearly all the costs are borne by rich countries. So a lot of the emergence comes from low and middle income countries. And again, it's a bit like the polluter pays principles. So if it's going to be the high income countries, which are the ones who are going to bear the cost and suffer the most, then I think there is an argument that they should invest in systems and surveillance systems in low income countries, both because, you know, low-income countries, although if you do the economic analysis, their costs are far lower for lots of reasons, partly because their GDP is far lower, and also they have much younger populations and all sorts of reasons, that in actual fact, COVID has cost more in Europe, America, Australia, than it has in Kenya, Chad, Senegal. Then I think there is an argument that rich countries should, in their own self-interests, but also in their public spiritedness to prevent and protect people, the most vulnerable people, the people in low and middle income countries, they should invest more in making these systems work. It's not, we actually know how to do it, and we're getting better at doing it. It's just a question of willpower, political willpower, and understanding, you know, that this is one of the most effective and efficient things we could do to prevent the next coming pandemic.
And what about ordinary people? I mean, everything that you've mentioned is kind of at the level of government and policy. I mean, as myself as a normal consumer or citizen, what can I do?
Well, citizen science is something which is it's a very interesting area. It's actually been used most in things even like bird watching, where you generate, you know, hundreds of thousands of people to go out and take pictures of birds. But there's no reason why you couldn't employ citizen science more. I'm talking about novel surveillance, like I mentioned drones, I mentioned cameras, community animal health workers, mobile phones. I think that we could have systems in place whereby people, we already to some extent in food have things in high income countries like Yelp, or people can give reports on what they think or what they experience. And these are not scientific studies. Sometimes we call them rumor registers, but you know, the consumer, the person who goes into a market and says that's wrong, why are those chickens blue, what's happening here, why used we have all of these cane rats for sale and now there's no cane rats at all in the market. I think if we unleashed the power of citizens, that could be very powerful.
And you say we're getting better at this kind of surveillance. I mean, there have been various governments running models of pretend outbreaks, for want of a better word, exactly like COVID, to try and help us prepare. I mean, have you been involved in any of those, or can you tell us why they haven't really worked?
Yes, I mean, we often call them contingency plans, and that means that people, that it's like what they call I forget the name, but like military, like war games, where people pretend there is a war and everybody's given instructions and go here, go there. Now there's a
Simulation.
Yeah, simulation, war simulations, things like that. I think one of the challenges is, as I said, they tend to fight the last battle. So the contingency plan will be, what if avian influenza breaks out? What if foot and mouth breaks out? But they don't tend to really think about what is something we've never heard of, the unknown, unknowns. We're poor at planning for those. I think they do help. It hasn't been a disastrous response. It could have been a better response. And also, it's when I think there's a lack of experimentation in the face of a crisis, like lockdowns. There was this, people said 2-week lockdown, and that will break the transmission. And here we are 2 years later, and we're still talking about lockdowns. So I think there should be far more, try it. See, does it work? But if it doesn't work, stop doing it. And that also, it applies to things like events where people are singing. That seems to be a super spreader event where people are singing loudly. Okay, we have enough evidence that you shouldn't do it. Stop it. But yet it has continued. Or events, where people come into the street, or political rallies. No, you can't have a wedding because that could be a super spreader, but you can have a political rally. There has to be more evidence and science. And once we've agreed that jogging by yourself, you don't, in an open, ventilated area, you don't need to wear a mask, then somebody says, remove that rule. Don't, otherwise the police or someone else, the authorities will just use it as an excuse to harass someone. But if you have agreed that, being in a crowded event where people are not vaccinated, and even with Omicron, a lot of people were vaccinated, well, then you say, okay, stop those. There really was I would say, on one hand, too strong a reliance on science, follow the science when we actually didn't have the science. And that made people very suspicious of the science. They said, you don't even know what the science is yourself. You keep changing your mind every week what the science is. So why should we follow you? Why should we follow the science? And then the second problem is when we actually do have good, randomized controlled trials and good evidence and good experiments, yet still the politicians are too scared to act on it because they always want to play safe. And then, so that's the two challenges. One is following the science when the science is not there. And the second is refusing to follow the science when the science is there. And those are the two things which I would do differently.
You've mentioned avian flu a few times, and from when I was reading up on this story, it seemed like that was the pandemic that people were predicting. Sort of 2007, we were saying it's going to be another bird flu. And then we've had the various coronaviruses, and now what was a very obscure virus has suddenly become kind of a celebrity. So we're probably going to be quite focused on coronaviruses. Do you think we should be, is it more likely that the next one will be an avian influenza? I mean, is that still a more likely culprit for a pandemic, or should we just be prepared for anything?
We should be prepared for anything, but it's like the gambler's fallacy. It's just because avian influenza hasn't happened doesn't mean it's not going to happen. Avian influenza is still very high on the list. Since as we've had sort of semi-reasonable records since like the 1700s, about at least once a century, sometimes several times a century, we've had major pandemics. Some of them very, very serious, some of them very, very mild. I mean, the avian influenza, the influenza of the 50s, which was again, it came from Southeast Asia, was relatively more important than the coronavirus. It just received kind of less publicity. So there's many to keep an eye on, certainly coronaviruses, certainly things coming from bats and rats and primates. But avian influenza, the risk has never gone away. And I would be, thinking, I think if I was making a bet, and this is just a guess, I would say avian influenza is going to be the next one. It's not going to be something weird. Corona kind of came out of left field. I would say the next one is going to be something a little bit more predictable.
And then can you tell us about One Health? What is it? Why is it important? And how should we be implementing it?
Well, there's so many different views of One Health and many definitions, and many people like their own definition better than everybody else's definition. But for me, it's the interdependency of human, animal, and environment health. And that if you want human health, which is our aim, you need to have healthy animals, healthy environments, and also you need to be aware of what's going on in animals and going on in the environment, and that's where you stop things, and that's where you prevent things, because once they've got into humans, it's too late. So for me, One Health is this interdependence of human, animal, environment health, and doing more early where it matters. I mean, rabies is an excellent example where we've shown over and over again, if you can vaccinate the dogs, it's much cheaper than waiting for people to get bitten by rabid dogs and then giving them injections afterwards, or in many cases they never even get round to get injections, and they die of one of the most horrible deaths imaginable to humans. And yet we don't do it because people spend money on medical things, and there's little money to spend on animals and the environment, and there isn't someone who's got that big picture, that big vision. It's coming, the tripartite, what we call the FAO, the WHO, the OIE, and now the UNEP, United Nations Environment, and that was part of the report. That I think they're coming together, and I think that's what we need. We need a kind of a global vision of protecting or preventing pandemics and protecting human health.
Because it seems to me, it sounds a little dramatic, but that the emergence of a pandemic like this kind of encapsulates everything that we're doing wrong about living on the planet. I mean, does it feel like that to you?
I think it highlights it. I mean, this one, factory farming, was not an issue. But others, definitely it has been. Factory farming is one, but factory farming can be done. You can keep large numbers of animals in small spaces and treat them very well, and ensure their good health and good husbandry. So factory farming can be a bit of a sort of a word which has got negative connotations. Intensive, what we sometimes say is sustainable intensification, so that you can do it right, but we're doing it wrong. Most of it we're doing it wrong, and in some places we're doing it very wrong. Wildlife is just a disaster. We're doing that completely wrong. We're overexploiting, over-harvesting, not conserving. So that is a huge challenge. And then just the whole way people eat, and the way, as I said, 80% of people are getting food from these informal, traditional wet markets, which are largely ignored, which are very important for people. They're places of cultural importance. They're places where people get cheap, accessible food. People who don't have fridges, who don't have cars. We can't ban them, but we can make them safe and clean. But nobody is trying, nobody is investing. They're spending money on phylogenetics and multi-million-dollar machinery, and doing all sorts of interesting things, which leads to publications in Nature and Science, but they're not necessarily doing enough on the ground to make food clean and safe, and ensure that the next new disease is picked up early, and that the wildlife are safeguarded, and that the livestock, which we rely on and poor people rely on immensely, are healthy and happy and are not going to be part of this spread of new diseases.
Has this pandemic changed the way that you do your work, and do you think it will change how you approach your work going forward into the future?
Yes, I think definitely there is more interest. I mean, I think as I said, we're a livestock research institute. You know, one the main one in Africa, based in Kenya, but with working all over Africa and also parts of Asia. We're going to be more focused on emerging diseases because we respond to our donors and also to public demand, and that's their demand at the moment. They don't want this again, and they want us to help ensure that it won't happen. So I can see that there will be more interest in One Health, more interest in zoonoses, those are diseases that come from animals to people, more interest in preventing things. And also in new technologies. You know, we're only starting to really realize the potential of everything from blockchain to, you know, chips which can be implanted, to drones, to mobile phones, to satellite technology. You know, some of these really could be breakthroughs, and scientists, people like us, should really be at the forefront of trying to make that happen, without forgetting our foot on the ground and not spending all our time playing with our nice, you know, shiny toys, while actually quite a lot of things might just mean getting running water and proper sewage to places where, you know, large numbers of animals are sold in terrible conditions.